And the topic near complications of high and low blood pressure. Na complications no wahefa. High pressure, low, and also sweating.
That's it. Let me say, you can say high blood pressure. I'm out for the. I'm what?
There's more jabroso.
So they say you can we you can was me moja broso. We say obi moja sotia your friend anemia. Oh. Na so moja ko broso de no so your friend no hypertension say obunya na broso e no e dos bebre a. And a friend polycythemia.
Moja dos bebre.
Moja dos HB no say HB no hemoglobin e form say why anemic. Now, because now age be nam through bibria, and okay, polycythemia. Into you can say BP and a high blood pressure. And the back, young can say Casimir say moja bros or not. I'm say tree
and Chassia no
tree professor, so more no my word for from. Because moja abros and I say HB hemoglobin abros on a polycythemia. Just a moja poly mini.
Okay. And to convey the real meaning of high blood pressure.
It mean convey.
Okay.
So, in fairness, okay. In fairness, say Buja bro.
So, see a best son.
Internet say, Obi Muja pressure, a for sunny own tinimu. A cost will be brea. I say, you are will be a papa. Say pressure no cause be bra no your friend hypertension and I say high blood pressure. Na eno no emi say ya bohu dewa say ene inyarewa bebre na enyenam enye say pressure ne keke na akoso na so ede nsunsuanso bebre etumi bre nipedia no ene wapomuden yankasa. Na ade ba ku bi so ho a ene ye boso a ye friend low blood pressure so. Low blood pressure no nkrofo ho a omomo pressure no so eno so wo fom. Inti obi beka say dey na ye normal blood pressure. Oko ayaresa bia ye de ade chekere wonsa. Na ye say ye check pressure ahwe. Ye check ya ye nya figures be say oblipi no 120/80. 120/80. Emre bebre no ye kan say sa ade no ye check na ye nya 120/80 a. Anker no ene ye fa na say e normal blood pressure. BP no say dia umoja edi afrosane no pressure edi move no 128 nanka eye normal. And also in chest 138 ya onye normal. Baby no 128 na say hallelujah. Uko 138 ya say eye mbomba hwenia ma bi ye kakra. Udru 140/90 ya. Yes borderline ya atra. Ho de ufiri ho na oko 141/90 and 141/91 cry say oya nya BP na ya aye bibi oho na every BP every 140 echo 140 160 180 190 200 over bibiano and the high blood pressure ye wo mu nchemu kakra ye wo ebia severe hypertension malignant hypertension hypertensive emergency hypertensive urgency ni nyina e wo ranges no mu na ene no ye kan ba ku bi aka ho se ye mbra fom kakra na so bi pressure so etiba fom na e bia eba 80/50 eno so de eno ye friend low blood pressure eno no the protocol ye friend hypotension hypotension e kosuru bebere ye friend no po ye po I was right, you see. I was right, hypertension. Now, a teba form, na a form too much. I find hypotension. Into be because low blood pressure, and also infetia say, and a real heifer. Pressure bang and the becca say a low blood pressure. Now, Macase BPI be say 128, no, normal, and also in chest say over 110. 70 onye normal 110/70 so no and also normal ni nyina range a yerehwe obi de kra 100/, maybe 60 and 100/70 and also once anipa no onya ni me bia mebebo so no be fa ne say also BP a nam no okay 170 180 160 ebi also de nam no a emma won so boni bia de okay
okay
na mom say ka say low blood pressure if it is no hefa you can say from 90/60 na tiba for if you are anywhere below say BP no you ko check it na 90/60 and I say for my o dey 85 abia 60 85 55 70 50 this are near and low BP. Na me ka asem bi so baako and asem for also say me kan obi wo ho a onam ho e dey be ko check ni blood pressure you catch and say 90/60 no say eh na me low BP o eno no a doctor for no no high and bebre this say be BP no e kosro a force di frusane wo ntini mu no ebetimi ama o kidney asai and I say ebetimi ama hypertension sorry ebetimi ama stroke heart attack ni ade no ho no high bebre but ye ba no low blood pressure na obi e 90/60 nso o de obo de ko bibia o yi obi bia emma nso so bia so men worry wo so BP no ana e bia sa time no e bia na onyem na e bia o BP aba so ati aba form kakra e say o e bia nyinsen nti na aba na sa ana o bi so wo ho e bia na onunum bi ana se bibi na ama na BP aba form ana e bi ana se e bia underlying cause bi wo ho ana se disease condition bi ya bibi bi e friend no omomunya compo ya e friend thyroid diseases ana say hypothyroidism no sa nya ma no tumi ma obi BP e form but se ko check ni nyina na uni sa hypothyroidism bi uni sa hormonal problems bi uni bia na obi BP 90/60 oh tumda
kai memra e share program ya sifufuro na topic bi e say know your numbers
yeah
it was say about BP no mu a was say hunu say
exactly
hana eda
correct
like say
BP no say all the time e be check unante ko hospital yes o yare unante ko o be check me BP in your normal state you check my 90/60 oh no problem once I know yenhu course bi I dey be adduced to say BP 90/60 no and the tumu da we okay na mum say BP wo form na afide unama na we ne so brew hono na asem wo ho ana say obi wo ho a BP wo form ana say bia obipi e wo eda baby oda ho na so it na sepe
no ni su
we need to change say all of a sudden no I say we are theater you feel like you are fainting unya fainting spells dizziness no na I say baby enkoyi obipi no a drop it na yehu yenti asem say yehu say de bia nkwala anase ye ko ebia independence ko na nkrofo gina ho bebre for a long time asoja for ni ade obe gina ho saa o gina ho bebre na on sesa opposition a eno so no ma BP no etimi etiko form kakra na eba ne saa ne enti e ka say ye won over pressure ne say o moja no ehia pressure bia edi bedi ifurosane na say o gina faako on say ade bia e wo soro no gravity etwene be form enti o gina faako saa
na twe moja no ba form afidi emanu ni afro sane ekoye sane nko
na enkosru bebre eba na say afide brain no anase brain na da otirimu no enya moja dodo a ehia ede bedi nedwuma enti house afide on say nipa no na santan
enti sa no o suggest say nipa ko no onye dan because bibi di say soldier fire service prison can you create no water prison service omuko gina ho a yese wo se wo gina ho a obehwe na omampani anase pani bi na wo se oba o cha onyama nti nipa no so be koso agina ho a sa nipa no onye den ansa na be ansa na abusu for ye ka safa blood pressure we ubona sa udi agura hwe so be si abono no wan sa mpe say blood pressure amen scientific herbal and alternative medical hospital so said medie ebremo come say around this time na amen free medical screening or say obi bia bra free na behwehwe wo ya de me sure say pressure kura ye ka ho asemi I was say bra no ukọ check your pressure ni nyina ukọ amen be ya ma na oye no free nso o she sade ya se every 3rd February nei na ye wie nti tutumrika kura ansa na 7 PM no abo mo ben dome ne mpotamu mo be kọ dome ho Ukoha, it's net flat, or cover be a railway, no one will go with your more. Fee, a shaman, Temman, Potemu community, one folding in a Umbeko, Clagon, Underbridge, or Munkola Shibi, a shaman, Quanaso, Munkona, Mukwa. Amen. Besham, come on. Now, your person, people call for so now, Banamo prep new business, say, wo be near the identity. For number, yes, and what could do, and what book you do, I be my number 020-722-9505 0244-227-192 and now 0245-275-254. Allah Shafi, any Amen Scientific Herbal and Alternative Medical Hospital. Omo emrane so mo gidi senyame ene yare safo doc na me bisa question bi say enti obi a ogina ho saa no sojani okwe wo pese o so the commander ani
asemo and even occupational hazard
enti obey dey
ejuma ko fire
but then we hazard na free ho
ene ogina ho enti no minim so mom special training bia but ye can be say enkai say utimi sisan opposition kakra won say
so we gina attention and anka we gina at ease kakra
yeah now when you are grinding when you street na attention na
one to show mbeka say come na do
sometimes e come so to me cause so e come so to me cause pa na no your friend posture hypotension intino yes postural hypotension so what system position and as you gina ho sa pressure number form because of your posture. So no be so say be oda ho no sorry gina ho or no sorry gina ho to one spare. Now I say ni so abenu blood pressure no timber form till you track akra wu so na no ankasa body na adjust
no. Now why steady.
So one of the things that low blood pressure bit me cause and they say we need to be ma we ni hani and they say to stroke me no dey no say to stroke me no we ma ni hani but a bit me ma obi ni so abre no sometimes low BB no ebema nipa nanya headaches near the
high when it pie no so obi betimi e de sa conditions a o can be betimi e de a conclusion say the pressure cost na akofom say be na say ni pie no do or so that na ni switching no obetimi de no aye bibi agina so aka say
ho na doctor unhia no
okay
we need so ebrewa na so sorry na otra on paso o sorry na trans no we need to trawa it's possible say a bit me postural hypotension a bit me bibi so refer no BPPV benign paroxysmal positional vertigo and I say vertigo and also sometimes about adrenal control your balance bibi we adwini BC chire refer no cerebellum it can be a factor bibi we assume one inner ear refer no semicircular canals 3 mutually perpendicular amu control say uti actually say you kata we ni crown him say machia say now be a control your balance into a bit me say it could be an inner ear problem I have vertigo and I say some other conditions I frame Meniere's disease near the idea and no it's a doctor never catch us say we no and yet low blood pressure na cause so and I say we no say me say the condition we will describe it idea na a vertigo and I say be fufuro into that's where the doctors needed to make sure that he can decipher between what is actually causing your dizziness. Will be dizziness. Say muja so na ate. Last will be whom say oh, say muja so what you mami muja drew. Me say oh, na me hwe ni ase kokokokoko. Me say oh,
say muja oh.
Muja de temu eta hopo. Na fe yan kohwe bi fre. Wa check BP ahwe. Low BP ma obi eni subri nu. High BP so etumi ma obi eni subri no sa. And I say yan ko check say bia o yes it is saying and nema we ni subri na ehu source of the problem na after ni ahwe said ya because
na o kan yes na me ason eno ne pressure no
eno ne na say ason no de pressure no amu ni link biasa but enu subri na me can say hypotension no low blood pressure e betimi am bi ni enu sabre no ni ama foforo bi wo ho eno so etimi ma nipa ni subri no e bi ni can say ear assume effects from inner ear problems sometimes brain problems cry etimi ma obi ne balance on nantia say no o chia kofa akone ade no nya niam obi a yetri say doctor no betimi a say we a balance problem every asumu and I say balance problem every cerebellum and I say adwene ehu chima bibia ko chima wona adwene ho nti no it's obi a getune professional no betumi a chew sunsun so a eda saa niama we mu nti no in terms of the complications no high blood pressure dem say at high blood BP cause record
emu ne o he na ehu pa
high BP
high any
low no so no sometimes no eba sa o low BP na clinically significant and cinema ka no obi a low BP na clinically significant say ema clinical symptoms but say edu baby enra say obi frame say na obi BP ewo 70 or 40 bps na normal say enye normal and but me bisa say one nipa no within fear hen and obo nipa 80 years and me say ne go so say o numu nro bi na adasa bi so okay bia sa na entina abanesa so bibie no ye fa clinical picture and ye de kasa say enye say o kan ya na tra na me say sa na
doctor edi eni or the doctor eni behwehwem
exactly efriu
yes sorry ya
can into no low blood pressure obi de ne say afi de be mind na lethargic ne bibia ya boko na or da no weak ni ade no eno some of the complications despitemedia ba
doctor answer no beto aso no betumi ba say obi wo ho a from time to time fantini beka there ofri birth to birth
from birth to birth
ofri birth to birth odia sa dizziness no awaya wo ho na aba na wanu maduro bi na ekọ enkoda na aba be ye more of many chronic and recurrent
chronic you acute on chronic
acute
so
okay
on chronic
okay
all right so a bit maybe sir but you can low blood pressure here say obi pini low na e low all the time na unam na emma problem be there yen hu ne say a problem
okay
but say ya there BP no take off from na fe there we na say we need to brew this be so mu say eno de na problem ho na fe there say ehwe ne say edu na be ma wo na say be kire o ne say o ya ma BP no so akoso kakra na nka aboa wo eno ze be etimi edi hu juma obi wo ho a omo low blood pressure bibi ye fe bibi shock ebia oyoba na say be ma de be ebia oba bia moja tu no bebre intino oluzu moja na o blood pressure ebeye stable no efa blood volume no moja no said dia na dodo tie na ne volume tie nti ebia ukono bia kono monsa ono monsa bebre se bia otwitwa bia be say one carton wo ho and also obadun so sa no dehydrated sa dehydrating so dehydration e man moja volume no etiba form na BP na drop it now say ebia make us a BP e normal 120/80 na fi dokono musan bebre na odwunso bebre na BP na tia ba form wa dwene se de ye adwuma na used to BP enim ene 120/80 nti ko onum sa na na fi odwunso bebre na ma blood volume tia form o nante a bo say hwe na watwa ahwe so e hypovolumic shock nipa betumi akọ ni volume na so bi a se bio ofe ana se oja ne nan cholera time ba won say often and on and no often what was that
yeah
often now
off
well yeah you know e ba no say no so e ma obi BP ethical from hypovolumic shock this aniama we na come low BP a you can say you clinical low BP a no say obi sa na say di nsuo si ne so na volume no esa akos
doc
high BP ne the complications dey be bre and from head to toe BP was raw one complications the between your stroke ewom yemba yeni high blood pressure it may affect weni say pressure is moja di ko weni echi a odi bi hu ade no we say echi na fe de hu ade ye bio nti ye wo retinopathy hypertensive retinopathy yen free ho a ni aba yakoma
edoso
nti ye ko kidneys e be say ni ama bebre
doc that's a pa unfortunately ye di besi ha say na one of these days you see a casafa accident accident is here and then a chese dey be chese obi bewu obi benya nkwa
yeah sebo
does it mean so kwa kofro car or say wo hunu we bi kra betina na an accident ni be see bibi ho wo say wo ya na because we hear say accident asi 50 epra ibinum so awu ibinum wu ho a ibinum mu later then I me who say meka one of the three no ho say which of the three no meka ho for
elect ho
na wa question ho answer doc that's be brave